This short video, again, is going to focus on how you would read an ECG strip that you're looking at where the dominant pacemaker is in the AV node or the junctional node. And again, because it has nothing to do with the sinus SA node, junctional rhythms are all abnormal. So we are looking at this ECG. It's in your quiz. They ask you for your interpretation. Because you've studied extremely hard on junctional dysrhythmias, you know that since there are no P waves, and you see that these QRS are normal, you know this is a junctional rhythm. The dominant pacemaker is from the AV node or the junctional area. Junctional dysrhythmias are broken down into different categories based on how fast the heart's beating. If you have a junctional pacemaker and the rhythm is below 60 beats per minute, which our rhythm in this case is, it's only 43, we call that a junctional rhythm. So up to 60 beats per minute, it's a junctional rhythm, but over 60 beats per minute, it gets pushed into another category called accelerated junctional rhythm. And that has a range up to 100 beats. So if the rhythm is greater than 100 beats per minute, it puts it into the last category, which is a junctional tachycardia, where the heart rate is over 100 beats and rarely gets over 140. However, like other dysrhythmias that we've talked about, a junctional dysrhythmia can be in an ECG strip and not the dominant pacemaker. And here's an example. I apologize that I kind of cut this strip off a little too prematurely. There should be a nice P wave right here. So your first step is to find the dominant pacemaker. If this was on a quiz, I would make sure there was a P wave here, believe me. You would see the P wave here, you would see the P wave here, you would see the P wave here. So the dominant pacemaker is from the SA node, and thus the rhythm is a sinus rhythm. When you're taking the heart rate, when you have a dominant pacemaker, but you have something else that's kind of interfering with the rhythm, use the beats that are produced by the dominant pacemaker to get your calculation. In other words, you want to calculate your heart rate by using this beat and this beat as opposed to using this sinus beat and this junctional beat. So use the two beats that are produced by the SA node to get your heart rate. And when you do that and you count the small boxes divided into 1500, you'll get a heart rate of 46. So you've got 2 out of 3 so far. And the third thing, is there anything abnormal in the strip other than the dominant pacemaker and the heart rate? And there is, and it's a junctional beat. It's a isolated, probably escape beat. The SA node wasn't doing its job, and so a backup junctional beat came in. We know it's junctional because there's no P wave. We know it's junctional because it also has a normal QRS. So your interpretation of this ECG, if it was on a quiz to get full credit, it would be a sinus tachycardia. Now be careful, this is a sinus rhythm. The sinus rhythm is below 60 beats per minute, so that makes it a bradycardia. Sinus bradycardia, heart rate of 46 with a single junctional beat. Again, when you're talking about junctional dysrhythmias, in your interpretation, you don't have to mention that junctional beat is absent a P wave. You don't have to mention that the QRS is normal. If you call this a junctional single beat, by definition, I know that there's no P wave, or perhaps the P wave is inverted, but it doesn't matter. It's just understood by placing that in the junctional dysrhythmia category. Again, hope I didn't confuse you. If I did, let me know. Appreciate it. Thank you.